Welcome to HPA The Catalyst, a new name and new day for APTA's section on health policy and administration. HPA's new dream is about you. The dream depends on your engagement to spark new ideas and help create a dynamic and relevant future for the physical therapy profession. The Catalyst will shine energy and light upon your good ideas and the entire profession. We intend to support your passionate commitment to illuminate the physical therapy profession into the future. For the past 2 years, we have been on a journey to consider, strengthen, and clarify HPA's position. Our quest was fueled by your input and the input of hundreds of your colleagues. When we surveyed HPA members, we were astonished by one statistic. 94% of HPA's members recommend membership in HPA to others. The best compliment is a recommendation from a peer. On the other hand, until now, we haven't been clear in explaining what membership in HPA is and why it matters. In October of 2012, the HPA board met at an Easter Seals camp outside of Denver. We emerged from the retreat with a clear picture of who we are and what value we bring to the table, and with an energetic sense of purpose. One of the best things about HPA is the fellowship and friendship between the members, as you can see in these pictures of the board and leaders meeting in October. We're excited about our position in the community and have launched a new identity. We've been working to build recognition and enthusiasm for the brand. Thank you for joining us to help us shape the implementation of our new brand. APTA's Health Policy and Administration section will now be known as HPA The Catalyst, accelerating leadership and innovation. A catalyst is a person or thing that precipitates change. From the beginning, we have been the choice for APTA members who were interested in change framed by dialogue around issues not addressed elsewhere within the association. We'd like to think that HPA's history and continued efforts in advocacy helped influence the outstanding government affairs work APTA does today. HPA felt strongly that in addition to being great clinicians, physical therapists have to also be leaders, providing leadership in their institutions and in their communities. To that end, the LAMP program was launched. Those who have made the effort to be LAMPsters have been unanimously enthusiastic about the experience. We are proud of our Global Health and Technology SIGs. The Global Health SIG has sparked interest in the essential contributions we can make as a profession to bring critical support to communities stricken by disaster, recently Sandy, and illuminating communities that have been systematically underserved by good health care. Health information technology is changing the healthcare environment tremendously. The Technology SIG is working collaboratively with APTA to educate members about the impact and opportunities. The SIG has been illuminating new technologies through its popular Technopalooza. HPA members get it. They see the important work going on. Now it's time to increase the impact of that work and to generate excitement and innovation around it throughout APTA. HPA The Catalyst will continue to support the Tech and Global Health SIG's LAMP, while opening the doors for other new important emerging initiatives. We will continue to nurture the seeds already planted by the many people who had a vision or an idea to move the profession forward. At the same time, we will encourage others to bring their seedlings to the fertile ground of HPA and will help them build community and support. Because we are diverse in our programs and because we don't represent a single subspecialty, like oncology or pediatrics, for example, the exciting work has remained invisible to the majority of the APTA members. Because we've been low-key, most APTA members haven't taken advantage of the tremendous opportunities available through HPA. So, here's our breakthrough thinking described in 5 easy pieces. 1. HPA, the Catalyst, takes a wide view of society and focuses on the big picture of healthcare. 2. HPA, the Catalyst, collaborates with all sections, affiliates, and APTA. It is boundaryless. 3. HPA, the Catalyst, serves as a think tank by creating what is next for the profession. 4. HPA, the Catalyst, will develop ideas, programs, and services to maturity, and then pass them on to be integrated widely throughout the profession. And 5. HPA, the Catalyst, will build connections, foster collaboration, and make change. Here's how it will work. When an APTA member has an idea or a question that isn't already being addressed, that member will think, aha, HPA The Catalyst is the perfect place to explore and develop my idea. Then, if it has merit across the profession, HPA The Catalyst can help members interested in the particular idea connect, help them develop the idea, and then help the idea find its place within APTA and or one of its components. What they discover at HPA is a critical mass of members who share their passion for getting every physical therapist promoting health and active living throughout their communities. Today's world requires partnerships to reach the highest level of achievement. Partnership is our model going forward. So what does this mean for you? It is an invitation to you to bring us your best and brightest ideas and your concerns. We are committed to helping you connect, collaborate, and make changes that matter. We will help you excel based on your passion, help you put what is in your heart into action. Through HPA The Catalyst, you can participate in identifying emerging trends to create the future of physical therapy. We want to be the place where you engage collaboratively to advance the profession. We feel confident that many APTA members will find a profession home here to explore emerging ideas and interests. It's not about where you live or what your professional specialty is. It's about your approach to life and the profession. It doesn't matter whether you are in orthopedics or sports medicine, treating children or treating the elderly, working with the acutely or the chronically ill, whether you live in Ohio or Florida or California or Haiti or Guatemala. What does matter is how you think and your aspirations and passion for spreading best practices in good health throughout society. APTA members have a strong commitment to social responsibility. Recent conversations have focused on doing a project for people with disabilities through the Peace Corps and changing the perception of disability and what it means. Other conversations have explored how we can support underserved elderly populations. Through HPA members, float trial balloons to see where they go without committing significant resources or building elaborate structures. HPA embraces young people with big, bold ideas and senior professionals with brilliant and not so brilliant ideas, side to side. Mentoring naturally occurs as students and new practitioners interact with the legendary heroes of the profession. How will the new HPA The Catalyst benefit APTA, the other sections, and geographic chapters? We're working to strengthen our ability to embrace new ideas, nurture them, build movements around them, and then launch them across the profession through APTA and its components. Today, we're asking for your support and your help in defining how this could work, with your insight and input to further our plans. We believe that HPA will benefit from this market position, but more important, we believe the profession, APTA, and the component societies will also benefit. As we develop this change process, here are some things that we pledge not to do. We will not squelch innovation by discouraging risk-taking. We will not impose change without seeking input. We will not keep people in the dark about what we are doing. We will not divide the organization into we versus them. Typically, people respond to change in one of three ways. Some are naysayers. They're opposed to any idea that is new and different. Some are bystanders and take a wait-and-see approach. Others become cheerleaders for change, which we hope you will decide to be. HPA and your professional colleagues are creating a movement, and you are invited to come along. HPA The Catalyst is for the tribe of us who want to accelerate leadership and innovation. Thank you for joining us on this new adventure.